G'day everyone, Dr. James here with another vet tip. Today we're talking about applying eye ointment. Let's jump straight in. So you need to apply a thin strip of the ointment directly onto the surface of your pet's eye or eyes. You want to use your thumb and index finger of your dominant hand to hold the tube. And you can see that I then use the free fingers on that hand that's holding the tube, as well as my other hand to try and hold the pet's head steady and also to hold their eyelids open. Once you've applied a thin strip of the ointment, you can gently move their eyelids open and closed, sort of like they're blinking, and that helps spread the ointment around. How much to apply? For most ointments, a thin line about 1 centimeter to half a centimeter is appropriate. But if it comes out as more of a blob than a little line, then a blob about the size of a grain of rice is ideal. Some tips for restraint and handling. You want to practice holding the tube between your thumb and your forefinger and thinking about how you're going to use the other fingers on this hand and your free hand to hold your pet and also open their eyelids, right? If you sort of practice that a couple times, just thinking about it, might seem silly, but it's very helpful then when you actually have your pet in your hands, if they're squirming and, you know, a bit worried, and you've got a bit more of a sense of how you're going to approach this. If it's extremely difficult to hold your pet still, you can try applying the ointment to the tip of your finger, right? And then applying that directly to the surface of your pet's eyeball by holding their eyelids open and using your finger. The trick with that is you need to have very, very clean hands. So make sure you wash your hands beforehand and afterwards. It's helpful to remember that you catch more flies with honey than with vinegar. So if your pet is worried, be very gentle, use lots of positive reinforcement. And if you're finding it's still not possible to use the ointment as directed, get on the phone, give your vet a call and explain the difficulty you're having. They might be able to prescribe different medication. Sometimes eye drops would work instead of ointments, and they may be better tolerated by your pet. Each vet has a few different tips in their bag of tricks to help with patients that are nervous with applying eye ointment. So, getting their advice if you're struggling is really beneficial. What if the condition comes back? Can I reuse that old medication? No, 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 no. Okay, it's really tempting to do this, but eye medication is not safe to reuse. The active ingredients in eye ointments can be safe for certain causes of eye disease and very dangerous for different causes, right? And the eye might look quite similar at home, but it's not safe to assume that the underlying cause is the same, right? Using the wrong medication can cause rapid deterioration and even result in losing an eyeball. What you can do is take any medication that you already have to the clinic when you go for your visit, and if it's safe to use, the vet will let you know. If your pet has recurring eye issues, try and see the same vet each time. That can really help you get to the root cause rather than just treating the symptoms. And if you find that the issue has happened before, make sure that you attend any recommended rechecks, right? Because assessing your pet's eyes after treatment is often essential to getting the correct diagnosis and to stop the issues from recurring. I'm Dr. James. Good luck. Right? Not all pets are as tolerant and lovely as the model that I showed you in the video today. Remember to be patient, be gentle, and use lots of positive reinforcement. If you found this video helpful, please like and subscribe, or leave a comment, or do all three. Right? That lets the good folk at YouTube know that you found this video helpful, and that's going to help other people to find these videos in the future. Thanks, guys. See you next time.